So we had a fascinating session discussing the use of artificial intelligence and how it can enhance healthcare. So we spoke about how first you need the digitization, then we need to think about democratizing healthcare so it's available and accessible for everybody. I was able to share some of the work that we are doing at Apollo hospitals in proactive preventive healthcare and screening, in risk prediction, in helping people reduce their risk of a disease. We also spoke about how you can use artificial intelligence to improve outcomes because data and knowledge comes easily. We have a clinical intelligence engine which is guiding clinicians, and because there is a global workforce shortage, it is important for us to help to train more people so that we can shift tasks and many people can assist the doctors. So all these were subjects that we spoke about. And finally, importantly, is the fact that the genetic profiling and the exosome, using this data and large language models, AI is not something about the future of healthcare. It is here today. So we have to work fast. We have to work immediately on regulation, on doctors adopting this technology, and on patients trusting this so that we can give better healthcare for the world. Absolutely. At Apollo hospitals, we have AI embedded into many of our processes. Our AI, we follow high ethical standards and data security. We are approved by the MDSAP as well as ISO, where software is a medical device. So there are many algorithms that we are using. We're also sharing. So we have partnerships with over 14 global universities and institutions, also with 3 governments that we are working and sharing our AI. As of now, we do not, but I would love to. It is an outstanding country with a very evolved and forward-thinking philosophy. So Apollo Hospitals would be very happy to partner with the government and to in some way participate in their larger global vision.
So I had the privilege today of delivering a session on integrative medicine. And integrative medicine really approaches medicine from the blending of 2 parts of medicine. One is the traditional allopathic medicine, with all of the amazing diagnostics and interventions we have today, with the holistic care of traditional health systems and focusing on lifestyle interventions to help restore the health vibrancy of an individual. Yeah, I've practiced this way for more than 20 years. And one of the most exciting things for me is to actually see patients who had diseases that I didn't know were reversible restore their lost quality of life. And just briefly as an example, I had a woman that came to see me with severe rheumatoid arthritis. She couldn't close her hands because she has so much pain. And her son was on medications at 19 for pain. I had shared with them about the power of lifestyle, especially nutrition, to help restore their body's systems and reduce inflammation and resolve the condition. What's interesting is they actually didn't have the money to go buy food, but they were so inspired and had hope that they discovered that a grocery store threw away food at night, and they went and bought this, out of the dumpster, they pulled this beautiful produce out and began making healthy meals. Within 6 weeks, all of the inflammation in her hands and body completely resolved. She had no pain. Her disease went into remission. Her son's pain resolved, and he was off medications. And they restored their amazing quality of life simply by changing what was on their plate every single day. Yes, I have the opportunity to work with several organizations here, Institute for Healthier Living, Abu Dhabi, and I'm working with a number of other offices and individuals to try and begin integrating this idea of lifestyle medicine, integrative medicine into the healthcare system. And the UAE is, I think, ahead of most countries in the world today in this area. They've done an incredible job dating back decades of beginning to use integrative medicine inside of allopathic systems to create healthcare that really looks at the health span, not just the lifespan of individuals, but to restore the health of the citizens of the United Arab Emirates.
Our session I focusing on the health issues and also especially focusing on the longevity or to solve the aging society problems. Creating the innovative technology cybernetics. By using these technologies, we can treat the human's brain nerve systems active functions or physical function, and we have the special technology to creates very narrow blood vessel, three-dimensional structures, no X-ray, no contrast media. Just yes, in order to prevent the uh, diabetic disease and so on, because finally these patients cut the legs and so on. Anyway, I love to improve the humans' health conditions. Yeah, sure. Then I visited here. So in order to find partners to promote these challenges with the foreign countries, for example, India's or Asian areas or Middle East and so on. Then I try to find excellent partners. Now we are connecting the hospitals and homes or working areas every time. So we always check our health conditions by using small vital sensors and so on. And these data are completely same in the hospital device. Then we can check most of the people's daily life. Then, so by combining such kind of technology and also by combining the regenerative medicine or drug fields, I try to create the new challenge fields for the health fields.